Welcome to OncLive Insights Inside the Clinic. Today we will be discussing acute graft-versus-host disease. My name is Dr. Chen. I am the director of the Blood and Marrow Transplant Program at Massachusetts General Hospital in Boston. Joining me today are my colleagues, Colleen Danielson, one of our nurse practitioners, and Dr. Zach DePhilip, another physician in our program. We're excited to be here to talk about acute graft-versus-host disease because we feel it's very relevant to what we do each and every day. It remains an unmet need in our patient population and the treatment that we provide. And there have been recent advances which we're excited to share about and look forward to the future as we continue to improve what we do. I think the first issue is to talk about what is acute graft-versus-host disease and how it's defined. Acute graft-versus-host disease is a complication of allogeneic hematopoietic stem cell transplantation. We use stem cell transplantations to treat a variety of mostly hematological malignancies with the intent for curative purpose. And the therapeutic effect of allogeneic transplantation theoretically lies in the ability of the donor's white blood cells to be able to exert an immunological anti-cancer effect on the host's malignancy. The tax to that, or the complication to that, is that the donor and the host are not identical. They often match very closely immunologically, but they're not identical twins. And the donor cells, as they grow up, can often not only attack the patient's underlying malignancy, but they can also attack the healthy body. And that is graft-versus-host disease. That is the complication that we deal with. On a time framework, graft-versus-host disease is divided into acute and chronic. We're going to spend most of our time today talking about acute graft-versus-host disease. And that most commonly takes place within the first 6 months after transplantation. In the past, historically, it was defined as happening within the first 100 days of transplant. However, with changes in practice, in graft sources, in the chemotherapy regimens that we use, in the mechanisms of preventing graft-versus-host disease, and all the differences in practice that we do, that time frame no longer applies. Acute graft-versus-host disease is defined by the symptoms solely. It affects 3 organs: the skin, the liver, and the GI tract. Skin most commonly, GI tract second most commonly, and liver is the rarest manifestation that we see. It is true that in the last 2 decades, we have seen a significant decrease in not only the incidence, but also the severity of graft-versus-host disease. A lot of that is due to advances in other medicine. When I say that, I mean supportive care and other fields of medicine that transplant has benefited from. But probably the most important development has been improvements in how we type donors and recipients. With much more exact HLA typing, we've been able to match donors at a much more precise level. And that in itself has reduced the severity of acute graft-versus-host disease.